I want to be the first man on Mars, so I think it's going to be hard and have intensive training to get into space.
Yeah, if you want, you can go in a black hole.
Probably not.
Yeah, I'm pretty sure.
I mean, I don't want to turn into a noodle, so. What are you doing? What do you want to be?
During a vet.
Good afternoon. I'm Dr. Tamara Sloan.
My name is Alex Seabrook. I'm a senior child life specialist in the Center for Cancer and Blood Disorders, and this is my facility dog, Cantor.
Do you remember the first time you got diagnosed?
So I woke up feeling nauseous and I had a fever. They couldn't find what it was, so they decided to admit me. Like, it took about 2 weeks to find out. And then they found I had leukemia, so they gave me medicine, and that's the first time that I found out that I had leukemia.
We are always doing research to try and improve the cure rate and prevent kids from having their leukemia come back. We had a clinical trial that we participated in that added a new medication called blinatumomab, and we found out that it was associated with a much increased improvement in cure rate.
So it's like a medicine that needs to be run for about almost a month. So it's like a little backpack, and then the backpack has medicine inside and it has a monitor.
So you use the medicine that is in that backpack now, or are you back to a different medicine?
I already finished all the cycles last Christmas.
Oh, well, that's a perfect Christmas gift.
Do you remember the first time that you were sick?
I remember that we thought it was a flu. I went to a emergency room, or not emergency room, urgent care. I was losing my balance, throwing up a lot, becoming dizzy.
When you got to children's, what did they say you had?
They found out that I had brain tumor, or cancer cells inside my brainstem, which I had to have chemo treatment because it was too dangerous to surgically remove it. And when I didn't feel good enough to get out of my bed, the nurses would bring me games, or Miss Alex would bring me Cantor, and she would just sit up in my bed and play with me. And I would pet her because she's so adorable and awesome.
The goal of our child life team is to reduce the stress that kids feel when they're in the hospital. And we do that through a lot of different ways. We want to empower them. We want to teach them coping mechanisms, teach them about what's going on with their body so that they can kind of gain back some understanding and control over their hospital environment. And it's really important for children's mental health to also be supported while they're in the hospital. And that's something that we do by incorporating play into their day, and sometimes even using things like toys or a board game to help teach them about their hospital experience.
How do donations to the hospital help kids like you?
It helps by being able to pay for the medicine and pay for equipment repairs or pay for the therapy dog program.
So they can search for the research and for anything, so then they can treat what's if there's anything that's wrong.
Our child life team could not do the work that we're doing to support children without the philanthropic support we receive from donors. Being able to have the items that we need to help support kids during difficult procedures, help teach them coping skills, utilize different items, different toys and play items to normalize their hospital experience, maybe motivate them on days when they're not feeling well. We wouldn't be able to do the work that we do without our donors.
We really rely in pediatric oncology on donor support to conduct research. We want these children to grow up and to be productive and have a great life and graduate high school and go to college and get married and have children. And by doing research, we're able to make that happen.
Extraordinary begins with you.
Be incredible. Donate to Children's Health today.
Yes! We did it!